Hey everybody, thanks for tuning into Module 4 on Axis, part of our EKG Fundamentals series. Learning objectives for this module, you're going to be able to describe what a QRS axis is and what it tells us about the conduction through the heart. And you're going to be able to develop a method of interpreting the axis as well. Let's go back and review the basic conducting system of the heart. In a normal heart, we have signals traveling from the SA node down to the AV node, down the bundle of His, breaking up into the left and right bundle branches. The left bundle branch goes on and becomes additional branches, but eventually both the left and right bundle branches become Purkinje fibers that depolarize the ventricles throughout. So in general, the conduction through the heart, the depolarization, travels in this general direction. If we were to give this direction a number, it would be positive 60 degrees, with this angle over here being 0 degrees. This general direction of ventricular depolarization is what we call the QRS axis. I'll repeat that statement because it is important. So the QRS axis is the general angle or the general direction that ventricular depolarization travels. Most of the time, the angle is around positive 60 degrees, but in reality, a normal axis, a normal QRS axis, can be anywhere from negative 30 over here to positive 90 over here. So a normal axis is anywhere between negative 30 degrees and positive 90 degrees. And remember that this is the general direction that ventricular depolarization travels. Let's try to understand this from the perspective of leads. Remember what the lead is. A lead gives us a perspective or a view of the heart's conduction from a specific location. For example, lead 1 allows us to see the heart. We're looking at the heart with our eyes from this side. We see the lateral, the left side of the heart. Lead 2 allows us to look at the heart from the bottom, looking up. And AVF also allows us to look at the heart from this side, looking up at the bottom of the heart. Now, if we imagine that we are looking at ventricular depolarization from these leads, we would expect these leads to see the ventricular depolarization very clearly because they're all within the normal axis of the heart where the normal ventricular depolarization travels. Therefore, in a normal axis, we usually expect all three of these leads to show very positive QRS complexes. I'll repeat these statements just so they're more understandable and easier to digest. So a QRS axis tells us about the general direction that ventricular depolarization travels, and normal can be anywhere between negative 30 and positive 90. And remember that leads show us what the heart is doing from different angles. In a normal heart with a normal axis, we would expect leads 1, 2, and AVF all to have very positive QRS complexes because they get such a nice view of the normal axis. Now, as the axis starts to change in cardiac pathology, we see changes to these QRS complexes as well, and we'll talk a little bit more about that in following slides. So this is a table that summarizes the interpretation of axis based on how our QRS complexes look in each of the leads 1, 2, and AVF. There is a lot going on, but if you understand the basic concept of what's going on, it should be easier to understand how to interpret the EKG. And we'll practice a little bit in the following slides, but I do encourage you guys to go ahead, find EKGs in your clinics or online, and try to determine axis just for practice. One thing I do want to note, this table labels the angle of 0 to negative 30 as a physiological left axis deviation. You will hear some clinicians call this part of the normal axis, and others call this a left axis deviation. For the purpose of this video, I'm going to say normal axis is between negative 30 and positive 90. So it's okay to call this normal here. So in this slide, I just wanted to establish what left and right axis deviations are. So a left axis deviation is anywhere between negative 30 and negative 90. So anywhere going past negative 30. Remember that normal is between negative 30 and positive 90. So this is normal. This is the left axis. And then anywhere from positive 90 to 180 is a right axis deviation. And the rest over here between negative 90 and then positive 180 is called an extreme axis. This is rare and we're not going to be talking about it in this video. Okay, if you want to pause the video and try this out yourself, go ahead. Otherwise, I'm going to dive right into it. If you remember, there are 3 leads we want to look at to determine the axis. It's going to be leads 1, lead 2, and then lead AVF. You will notice that the QRS complexes in all 3 of these leads on this EKG are all generally positive. They're more positive than they are negative. This is consistent with a normal axis. Remember that the normal axis is between negative 30 and positive 90. So this ventricle is depolarizing within that range. And that's why AVF sees ventricular depolarization very well. Lead 2 sees ventricular depolarization very well. And lead 1 sees ventricular depolarization very well. So this is a normal axis. All right, take a moment to pause and try to identify the axis of this EKG. Okay, we are looking at lead 1, lead 2, and AVF again. Lead 1, you could tell, is positive because the QRS is more positive than it is negative. Lead 2, depending on how close you look at it, is either a little tiny bit positive or isoelectric, meaning it's going up and down at about equal amplitude. AVF, if you look closely at it, is negative. Let's try to understand what's going on here. So if this is the direction of lead 1, this is the direction of lead AVF, and this is the direction of lead 2. 1 is very positive, so we know that 1 is seeing that QRS very well, or the ventricular depolarization very well. AVF is negative, so AVF, unfortunately, is not seeing that ventricular depolarization very well. So what could this mean? Maybe the axis is shifted more towards 1, and it's pulling away from AVF, so it's going to see it less and less, sort of like in this direction. 2 is either positive or isoelectric, meaning it's going more towards that negative side as well. So maybe it's pulling away from 2 as well. So this axis, or the direction of ventricular depolarization, is pulling away from AVF, and almost, but not there yet, it's almost pulling away from 2 as well. So because 2 is isoelectric, we can still call this a normal axis. And what does that mean? Well, the axis is somewhere in between 0 and negative 30, which is still normal, but it's definitely going more towards the left axis side. So it would be fair to call this either a normal axis or a mild left axis deviation is okay as well. Okay, take a moment and try this one out. All right, so we're still looking at the same 3 leads. We're looking at 1, 2, and AVF. 1 is positive here. 2 is negative. You'll notice that it's going downward more than it is going upward. AVF is also negative because it's going downward more than it is upward. Going back to our diagram of the leads, so if this is lead 1, this is AVF, and this is lead 2. Now it's pulling away from not only AVF, but also away from lead 2, and that's why they're both negative. And because it's being pulled away from them in this direction, we're going to say this is a left axis deviation. Okay, take a moment and try this one out. This one might be a little bit tough to see, but you'll notice that lead 1 is actually a tiny bit negative. You'll looking closely at the tiny QRS complexes, you'll see that it goes down more than it goes up. So lead 1 is negative here. Lead 2 is positive. You'll see that it's definitely going up. And AVF is positive as well. It's definitely going up. Let's draw out our leads and see what's going on here. 1 AVF and 2. This time 1 is negative, so ventricular depolarization, the axis is being pulled away from 1. But 2 and AVF are positives, so it has to be within this region right here where 2 and AVF both can see that ventricular depolarization very well. So this is a right axis deviation. Alright, so the takeaway messages. First of all, I know axis can be a little bit intimidating. It's one of the more intimidating things of interpreting EKGs. I think with practice it gets a lot easier, and it makes a lot of sense if you take the time to understand the concept and why we call certain things left axis as opposed to normal or right axis. So we learned that the axis tells you about the overall direction of the heart's conduction, with normal being between -30 and +90. We talked about how leads 1, 2, and AVF can be used to determine the axis. And again, finally, stick to a systematic approach and practice it, whether it's the one I used or not. There are a few other out there that are useful in interpreting axis that you might find beneficial. All right, that's it for today. I'll see you on the next one on intervals.